probably can't use those because...
When you let your kid play, the first best practice is the fact that you're playing in the sport that's a contact or a collision sport means that if you have a concussion, you're going to tell mom and dad about it. You're going to tell coach about it, and if there is a medical person on the field, you're going to tell them about it. So you're not going to hide it. That's the first rule of letting them play in any kind of athletic sport. And then if one occurs, then both the coach and if there is a healthcare provider on the field, they need to be alerted, and you definitely don't go back in that day. So all of the guidelines say don't go back the same day, and really don't go back in until you have been evaluated appropriately, not just by any clinician, not by an emergency department, not by just your regular family doctor, unless they have had training in how to manage a concussion, because it's not as simple as you might think. Rec leagues are growing. I mean, we have no idea, even within our state, how many rec leagues are even out there. There's no one single registration. There's no way for them to report how many concussions are going on. The CDC is desperate to find good epidemiologic data about how big the problem is, but there's no reporting mechanism. It's not a reportable disease, and frankly, most of this is cared for on the sidelines or later the next day, and like I said, often without the intervention of a healthcare provider. Wearing the hat of the director for injury prevention here, I would say prevention is absolutely the key, because then you don't have to treat if we can prevent it. So that comes through better coaching, that comes through better tackling techniques, that comes through improved rules and enforcing those rules. And then recognition. Recognition is a key part. Getting athletes and coaches to accept that concussions are dangerous and that it's not okay to mask them or hide them.